This is symptomatic relief, making you feel better. But there's a disease process underneath it all that is driving this disease regardless of the medication that you're taking. And so the disease progresses, the disability progresses towards its end, and here you then suffer of prominent death, premature death. And this is usually where medicine kicks in. This is the area here. And what we're suggesting is maybe we shouldn't wait so long. Maybe we should do something about the signs of disease. A sign is high cholesterol. No pain, but it's a sign. A sign is high blood pressure. No pain, but it's a sign that something is wrong. Overweight, there's no pain, maybe some psychological pain, maybe some social pain, but there's no real pain as such. These are the signs that should wake us up. These are the rocks of the road that should wake us up and say, we need to do something about these signs of disease, and then move towards education and move towards personal growth and become involved in removing the causes of disease and coming out stronger than you ever were before. Are you with me? Are you out there? Okay. Now, this kind of an approach where we basically expect medicine to perform miracles for us, for chronic disease, usually after the age of 50. It's a very costly approach. As you see here, in 1965, we spent $200 per person. This year, we spent over $8,000 a person. That is the message of the president last night. We need to do something about the enormity of the increase in medical care. We can no longer sustain the expenses. Just to give you some idea, we used to spend in the 1950s, we used to spend about 4% of our income on medical care. This year will be 17%. I talked to the manager of Daimler Chrysler, the manufacturers of the cars, and they called and they said, we don't know what to do because 17% of the cost of a car that we build is devoted to medical care of the people who build the car. We spent more money on medical care of the workers than on steel that goes into the car. What can we do? And then they said, well, we're spending 17% of the cost of a car on medical care. Korean manufacturers only spend 3% on medical care. And they said, we can no longer compete in an international global economy. What can we do? And then we also look at the fact that many societies spend much, much less on medical care than we do, and they live longer and have better health. This may come as a shock to you. Please note, in the United States, we spend about $8,000+ a year. We live 77 years. Japan, they only spend $3,500 roughly. They live 6 years longer. In the British Isles, I was just there last week there, they spend about $3,000 or less, and they live longer than we do. Australia, about $3,500. They live 82 years. The point here is that we cannot purchase health with money. Health has to do with what we do for ourselves. Now, here's a question for you. Are you ready for this? When you compare people 100 years ago and their life expectancy and people today, have we gained extra years in the last 100 years? How many of you say yes? How many of you think we live longer today than people 100 years ago? Let me see your hands. Okay. How many of you say it doesn't make any difference? How many of you are not raising your hand for either one of the questions? Well, we are living today 26 years longer than people 100 years ago. And it's very tempting to give the credit to the wonders and miracles of modern medicine. But be careful. I was in England. I looked at some of the tombstones 100 years ago, and people lived 80 years, 90 years. And I thought to myself, that cannot be. This must be wrong, because I know people that shorter lifespans 100 years ago. We live today about 77 years. They must have lived minus 26 years. They must have lived 20 years. Less, 50 years. So I looked at these tombstones. 75 years, 85 years, 95 years. And I thought, there's something wrong with these tombstones. Maybe it was a Mason who had dyslexia. It wasn't 95, it was 59. And then I found in the cemetery there, I found many, many small gravestones. And it says, here lies our beloved little Heidi, 9 months of age. Here lies our little Johnny, 1.5 years of age. And all of a sudden, the light came on. What happened 100 years ago? Children, every 5th child died before the age of 2. Do you know what that does to the life expectancy of a society? Of course, it lowers it. So now you have to make adjustments for the high infant mortality, which is almost down to 0 in our society today. We can do some wonderful things there. We don't lose too many babies. So we don't really reduce the life expectancy of a newborn. In those days, in 1900, a baby born then could expect to live 49 years. Today, a baby born in 2009 can expect to live 76, 77 years. So again, you can say, aha, so we live longer. But once you understand that the infant mortality has dramatically come down, and you have to make some adjustments now for this, you begin to realize you have to ask the question differently. Can a person living today live longer than that is an adult person, a 40-year-old person, or in this case, a 65-year-old person? Can a 65-year-old person today live longer than a 65-year-old person 100 years ago? What do you think the answer is? The answer is yes, but it's not 26 years anymore. It's probably more like 5 or 6 or 7 years, because you now have made adjustments for the lower infant mortality rates. And let me also add here that many people may live longer today, but it may not be a high quality of life. They live in nursing homes. These nursing homes do their best they can, but you know, you can sometimes be in a coma for years. And so this is hardly a high quality life. So those extra 5, 6, 7 years, it's questionable, isn't it? It's different from the enthusiasm that you hear. They will live so many years longer today, and therefore this must all be because of the wonders of modern medical care. Here's Professor Eisenberg. He said, medical intervention after the development of chronic illness has little influence on how long people live. This is powerfully demonstrated by the negligible change in the American adult life expectancy. The adult life expectancy may have increased by 5, 6, 7 years, despite the heroic technical virtuosity of modern medical measures. And here's an article in the American Medical Association Journal that said, medical care has relatively little impact on health. Who determines health? Who shapes the amount of health that we have? Well, here you see Dr. Allen. He said, health is largely a function of how people take responsibility for their own actions. Promoting health, then, has to do with education and transformation, cultural transformation. We need to have a healthier society. When you eat out, you want to have a healthy meal without feeling like a health nut. You want to have paths. You want to have bike trails so that you can exercise. The culture has a lot to do. You want to have a culture that promotes good health rather than seducing us. The moment you turn the TV on, have you ever seen they're now advertising carrots and celery sticks? Or potatoes? What do they advertise? M&Ms, crinkly bags, right? These kind of things. And so I want to show you a video that will help you to identify the underlying disease process. This is a very, very important 2.5-minute video. This will help you understand why we have so much chronic disease, because we are systematically narrowing our circulatory system. The diameter is shrinking more and more and more. And I want you to take a look at the next DVD before you. Let's take a look.